and today we're going somewhere that every educator has needed to go and maybe even felt a little bit unsure.
Additional needs is a broad word that we use. It's not a particular diagnosis or label.
It doesn't come without obviously supporting tremendously the parents in this journey. When we say we have additional needs in the children, we also have to really absolutely include the bubble of the entire family.
Additional needs is a term we use a lot, but I'm not sure we all mean the same thing when we say it. Welcome back to the Early Years podcast, brought to you by the Early Years Academy by Parent App. I'm your host, Dana, and today we're going somewhere that every educator has needed to go and maybe even felt a little bit unsure of how to get there. We're talking about children with additional needs and what it looks like when an educator senses something and doesn't quite know what to do with that. We'll also be talking about parents, the parents that you'll be sitting across from who are scared and maybe not ready to hear what you're saying or even what you're seeing in the classroom, and about what it means to support a family through that process as well. I have two guests with me today that I'm genuinely so glad to have on the show. They're both a part of Caya World, a clinic based in Dubai that's doing something really meaningful for families in this region and beyond. So Caya World offers psychological assessments, including for ADHD, autism, and learning needs, aside from individual and parenting therapy as well. What I love about their approach is that it's evidence-based, it's culturally sensitive, and it's deeply family-centered. They understand that a child doesn't walk into a clinic alone, a whole family walks in with them. First, let me introduce Dr. Jihane Ghorayeb, a health psychologist, EPS chartered and assistant professor of psychology at RIT Dubai. Her work sits at the intersection between psychology, chronic illness, human resilience, and she brings a deeply human lens to how we understand children and families facing challenges. So welcome, Jihane.
Thank you so much, Dana, for having me, and I'm very excited and looking forward to this podcast and this conversation.
Us as well. And I'm equally as excited to also have Dr. Nour Al Ghriwati, clinical psychologist, co-founder and medical director of Caya World. She trained at the Children's Hospital of Philadelphia and the National Institutes of Health. She has over a decade of experience working with children, families, and young people navigating some really complex journeys. So glad you're here today.
Thank you so much, Dana. The pleasure is all mine.
So I want to start somewhere that I think will ground this conversation for educators listening, because additional needs is a term we use a lot, but I'm not sure we all mean the same thing when we say it. So can you both take me inside what additional needs actually looks like in an early childhood setting?
Sure, yeah. Additional needs is a broad word that we use. It's not a particular diagnosis or label, but what it actually is when a child requires a little bit more support than typically expected for his or her age to thrive. It could be, additional learning support. It could be social emotional support. It could be support for physical development. So the focus isn't so much about a diagnosis and more about how to best support a child and his family or her family.
Yes, exactly. And if I may add to this, it doesn't come without obviously supporting tremendously the parents in this journey. When we say we have additional needs in the children, we also have to really absolutely include the bubble of the entire family, possibly siblings as well, because going through a process will involve the entire family and would require the entire family as a support system.
100%. And what do you guys think that an educator tends to notice first? And also maybe let's talk about what they tend to overlook. Because I mean, in the classroom and even as a principal, I saw how sometimes additional needs didn't look like the textbook version. And, that's worth naming before we go into the signs and the conversations that we're going to have with parents. But a lot of times it was really easy for educators to pick up on the very obvious signs, but not the ones that we don't really talk about, like the child who who freezes, or the child who, let's say, selective mutism, or reacts very severely to guests or unknown people inside of the classroom as well.
So I think communication is something that you're subtly, referring to as you're talking about individuals that we might miss. So, there are signs, yes, as educators, you are the experts on child development. You sort of have the privilege of having same age peers that you can compare a child to. So if you see something that might, as an educator, seem off, like, with selective mutism, it's not speaking within the classroom environment, but as soon as mom comes to pick up the child, they're yelling and screaming and really loud and excited. Difficulties with transitions. If there are kids that just have a little bit of a harder time with transitions, they might be labeled as, oh, that spoiled child at home, but it could be an underlying sign that we might need additional support for the child. With communication comes bringing it up to the parents early. Like, I've noticed this about, let's say, Rami. I've noticed this about Rami. Have you noticed something similar at home? And having that conversation, because parents a lot of times tell me, I'm noticing this, but the school has said nothing, or the early learning center has said nothing. So it must be only happening at home. And when I send the forms to teachers, we figure out it's actually very far from the truth. They're seeing it, but maybe the communication hasn't been brought up yet.
I just wanted to add a few examples that I've noticed as well, and it's part of my. I mean, I'm a mom as well, and on top of being an expert in my field, and things that I've noticed by talking to other moms and experts is that exactly like Dr. Noor is saying, we need a very open communication, but it is very tricky for educator. And I'm also a professor, and I know what it means to have demands as an educator from your institution while at the same time, needing to meet some benchmarks while looking at every single child and then reporting back. And you don't want to alarm parents too soon because through experience, you know that things can maybe resolve a little bit later. So there's always like a personal call of when to report. And sometimes within that delay, maybe parents have gone, sought experts and then, they bridge the gap. But things that I've particularly noticed is that sometimes parents, so when, for example, an educator would not flag, would say, oh, your child is absolutely delightful in school. And, a little bit on the quiet side, but, plays nicely, listens, and, is very calm. And then I would see parents outraged because that is not the personality necessarily that it is expressed at home. And they feel that maybe that child doesn't feel comfortable expressing his or her personality at school, is not able to integrate socially. And yes, he or she is calm because they're not being, inclusive or included in the play as they should. So they would like more particular attention. So what is not flagged as an educator, what is normal for an educator, might also not be something that parents, wish to expand. They want the child to be more, how do we say this? Épanoui. I'm going to go for a French word right now, to be more expansive. So yes, open communication to see where are the needs seen by the family versus the needs also required by the educational system is important.
Then I wanted to go back to something that both Dr. Noor and Dr. Jihane mentioned, which is the fact that there is a gap between noticing something and doing something about it. And Dr. Jihane, you mentioned about educators needing to kind of wait till they're almost, let's say, certain before they bring something up because, let's say, their observations are wrong or they're not 100% sure. There could be feelings of resentment that linger. But why do you guys think that this gap exists, and why does then timing matter so much in early identification?
Well, what we know from research is that early identification correlates with better outcomes because there's more supports in place. And so that's what we know with research. In many parts in the world, there are early intervention programs that are specifically intended to help children because of the research that's focused on positive outcomes from early intervention. Why now for your question about why there are gaps in why there may be gaps in communication, I think there's a lot of fear and stigma among the entire community around what additional needs might be. And I think this is where, you know, true and honest, open communication between parents and teachers is really important, because the way that you phrase something might be actually more accepted for parents by the phrasing that you use and the wording that you use. I'll give you an example. Okay, so if an educator said to a parent, you know, he's having a lot of trouble with focus, I'm worried about attention, very hyperactive. The parent's almost like, you know, is she saying that my child has ADHD? They've almost sort of jumped to the conclusion and might have this defensive up. But if a teacher comes up and says, you know, I noticed that sometimes he has a little bit of issues with paying attention. Do you see that at home? Does that happen at home? What are you noticing at home? And having an open and honest communication, the parent might say, yes, of course, you know, listening to instructions, horrible. Or the parent might say, actually, I don't see that at all. And at least then you've opened the door to a little bit of conversation.
100%. I believe that it is very important to start the conversation in a way that establishes trust and not defensiveness or resistance. And a key, obviously, there are key terms to, if possible, avoid, such as I'm concerned, I'm worried. I mean, the parents are going to worry with like just by existing, just by being a parent. We do not need to add the educator's worry on top of their own personal hurdle. So I would definitely start the conversation even more broadly. And a lot of times I've seen this happen, and it's again due to the poor resources or the inability to find the right time. But sometimes parents are cornered at the exit or pickup, or they just have like a 30-minute team meeting to pack this entire conversation. I really believe to empower educators in general, excuse me, to give the time for this conversation, especially when you've observed long enough to feel that, right, this is the time when I would like to bring it up. I have sufficient evidence, maybe discuss with other educators. There's usually more than one teacher, whether for Arabic or even in the younger classes. There's usually like a professor for the singing. You want to make sure that you've seen and discussed that at length within the institution, and then decide it's the right time to bring it up to the parents. Find the right setting, find the right, obviously, words, and possibly, like Dr. Nour said, start by saying, what have you observed at home? Like, do you have anything that you want to talk to us about? Like, let the parents come up first. And maybe you'll see that you align, and then it would be so smooth because they've noticed it already. Or if they say, no, nothing actually in particular, and then you want to jump in and say, okay, so these are the strengths, right? Your child is super curious. Your child loves playing, you know, with this and this and that, and they're very good at this. However, in comparison to what we would expect at this age and time, you know, this seems to require a little bit more support. So this avoids the word problem, this avoids the word worry. Yeah. I know it seems very structured, but once you rehearse this enough times, it becomes secondhand, and really lowers the resistance, because they're not hearing like exactly like what Dr. Nour said. The word hyperactive, it might be insignificant for an educator. You know, it's like a sugar rush, right? But hyperactive has such a popularized term for ADHD. Attention, such popularization again for the ADD part of ADHD. He's not keeping eye contact. We think automatically autism. We want to really be careful, because things have trickled down in society in a way that alarms people, overly alarms over the diagnosis and the entire prognosis of the situation, which it might just not be.
I love that, Dr. Jihane. I love how you emphasized on the relationship, because as a principal, I felt the weight of being that person who had to initiate that conversation with a family. And my hesitation wasn't about my uncertainty about the child. It was always my uncertainty about the relationship, and about, what happens to the trust between us if the parent, let's say, isn't ready to hear this, or if I'm not choosing my words as carefully as I could. So I love how you emphasize on trust and Again, giving parents that grieving time. Whenever you do share something with them, you know, give them time for it to land. There are days where I barely have 15 minutes to pick up my child, yet rush back to my car to take my next meeting. So if a teacher had unloaded something really big in that moment, I probably would need a good 24 hours to let it sink in and to really feel it. So I love that. And Dr. Noor, I wanted to go back about what you mentioned about early detection. Sorry, I wanted to go back and talk about the early detection because we know that early years brains are doing something that it will never do again because of that magical window that we have and what's possible for children to achieve within that window. So I love how you started out by saying, again, how fundamental early detection is for helping a child get off on the right foot and ensuring that the support that they get arrives at a time where it can best benefit them. Yes, support is always going to benefit that child, but if we miss that window, they're kind of at a disadvantage, and we have that responsibility. So let's say an educator has noticed something, and now they need to have a conversation with a parent. So I want to sit in that parent's experience for a moment because I think it's easy for us as educators to forget what it feels like to be the person being told whatever it is about your child. What do you guys see clinically when a parent first comes to you or when concerns are first raised? What's actually happening to them or for them emotionally?
I'll, I do assessments frequently, and this is part of my weekly work. And I think it's a mix of emotions. Some parents come in and they're like, I know what it is. I just need the answer so I can get the appropriate support for my child. And once the parents get that, so, that answer, perhaps a diagnosis or perhaps, a request for accommodations or extra support, it's sort of like a sense of relief, like I knew it. Other parents might have a lot of fear, apprehension, a lot of, perhaps concern about the ramifications of, okay, so if my child, let's say, might have additional needs, what does that mean in the future for my child's education, for my child's friendships, for my child's overall development? So I think it really depends on the parent, and I also really think it depends on how the concern is communicated from the center or from the teacher. It can either really empower parents or leave parents having many questions to answer on their own or with the help of AI, which might either help or hinder the situation in terms of how they feel emotionally.
Yeah. A lot of times based on the key terms I received from the educators. If they don't have prior experience from other children or people around them, they would Google or AI research those terms. And again, you get a really plethora, I want to say, of information plus origin. And I want to say it's kind of twofold. There's a part as well that parents carry that is like, have I failed my child? Have I not supported my child enough? That's why we're here. What is my responsibility in this? And there's a lot of guilt and possibly sometimes shame, especially, I mean, not especially, but I do see it sometimes more often when it's a larger family. So you would carry the guilt. Okay, I was attending to the newborn, and then they're close in age, and I was like, dispersed plus working. Did I miss this? Is this on me? Could I have, had I been more present? Could I have I? So there's a bit of that also going around in that search, trying to find an explanation to um, remove that sense of culpability or guilt. There's also obviously the dying need to find a solution and that somebody can reassure them that this is not maybe for life. Like Dr. Nu said, the ramification is probably it is really the tipping point here. How long is this? Like, is this for life? What's going to happen next? And that seems like a mountain to climb, an anxious mountain to climb. And I guess the best advice we can offer right now is like, you're not sure there is a mountain. You're imagining a mountain. Let's see what it is first. Let's contact the center, and we'll talk about obviously in a minute pathways of how to refer. But it's a one step at a time process. And when you AI research anything, you don't get a one step at a time process. You get absolutely everything and every possible subtypes. So, to be taken with caution, that would be my advice to parents and educators.
I love how you brought to life all the things that they're thinking of in a moment, or in that moment when you disclose that your observations of the child inside the classroom. So I remember sitting with parents in my center, and whenever we'd reveal something to them, at times you could watch something like close inside of them, and at that moment, I think it was really easy for educators to mistake that for parents not caring. But that wasn't the case. I think what was happening is they were trying to process in real time what we were saying, but at the same time answer the plethora of questions that their mind was throwing at them, like, what does this mean? What does this mean for relationships? What does this mean for friendships? What does it mean for their academics, as you guys were saying? So 100%. And I think, again, if we don't recognize it for what it is, which is them trying to um, honestly just process everything that you've said, we can mistake it for them not caring, and it's quite the opposite.
Dana, can I say something about what you said that's so
Yeah,
important? And it also relates a little bit to what Dr. Jihan said. So, when we provide parents with information, like, there's something that's been on my mind, I want to share it with you. I've noticed this about Rami, so on and so forth. Sometimes, within that process, the parent might do or say something, and it's really important as an educator that you sort of name that and process that in the room. So, for example, as I would, instead of like, oh yeah, I think you should do this, and I worry about this, as I was talking, I sort of saw a look of concern on your face. Tell me a little bit about that. Or am I mistaken? Like maybe I'm just assuming, but what do what's going through your mind? Ask the parent. Stop and ask the parent. What is it that's going through your mind? Is it a, oh goodness, they're seeing what I'm seeing at home? Or is it a, why are they telling me about my child? There's nothing wrong with them? Or what is it? And if you don't stop and identify and process those feelings in that moment, it might seem like you're maybe overlooking something important in that conversation.
It is a two-way street, that conversation. And I mean, from a standpoint of how hard it is for an educator to bring that on, also depending on the cultural background of the parents and how exposed they've been. Is this a first child? Is this a third child? I mean, parents with more experience tend to react differently. Um, but you do tend to have the burden to bring it up. And so we speak faster because you just want to rip the bandage off. So pacing, exactly what Dr. Noor was saying, give the time. It means pace your, be mindful of the pace at which you're speaking. And now some parents will get anxious and defensive and will rush you. So what does this mean? So what does this mean? You are the model here. Set the tone. Slow your pace down. It says, we're going to get there. We have a whole hour to discuss this. um, I will lay everything out for you. I'll provide you with sheets of, where to do this and this and that. We'll get there all in due time. I just want to make sure that we're both seeing the same thing, or if you have anything you want to add to this conversation, because it's a constructed conversation. It's not just me telling you. I'm not a medical doctor here. I'm just telling you about my observations. This will be complemented by your observations, or we're going to continue to observe. So we're not here to set, you know, you have chicken pox and this is the truth. We are here to really construct a narrative, and that requires slowing the pace and helping the parents slow the pace down. And if there are two parents, usually you would like to invite both, then one might lead the other, and then you want to make sure the other parent is heard as well if they're not saying much, so give room for that too.
I love that. I know, even speaking for myself, as somebody who understands child development and who knows the research, when it's your child, none of the knowledge protects you from that first wave of feelings. So what you said is, in that moment, you could either go on and tell them about the research and tell them about best practice and tell them what they could do to support their child, or you could stop and acknowledge that first wave of feeling that comes over them, and build that connection. And that's what's going to make them want to partner with you in order to then, go through this journey together, and see what you have to say. And, and then they'll know that just as you saw them, you also saw their child, and you're in it for what's best for the both of them. So I love that. That was a really beautiful piece of advice, and something I wish I was able to take back with me into the classroom. But hopefully, for everyone listening, it's something that they can do as well. How powerful is that? And then, Dr. Jihane, I wanted to piggyback on what you said about the cultural piece to us dealing with parents. So we're in the UAE right now, and we're serving families from different backgrounds. And, I wanted to know, how much does culture shape how a parent hears this kind of news?
Um, I think it shapes quite a bit, to be honest with you. I mean, there are some cultural backgrounds that require direct facts, to things to be laid out in a very almost black and white fashion. Others require that the conversation be a bit more smoother, maybe less technical terms. There's also, on top of culture, I want to say the educational background. Obviously, we cannot tailor in that instant to every single aspect, but having a pace and a language that is tailored more or less, again, to who we're talking to can make a big difference. Um, my golden rule is avoid technical terms. I mean, again, if there's any technicalities, if there's any diagnosis, even if you're 100% sure as an educator, leave that for after the assessment. Let this be the next step rather than, dropping a bombshell with all that it implies, like Dr. Noor said about stigma, because the culture implies also the stigmatization. In some cultures, they are very well, I don't know, it's much more normalized. Certain situations are much more normalized, or they have more information about it. It's more prevalent. So, for example, I'm thinking of stuttering. A lot of the times, it could be because in that particular family, there's more than one language being shared, and then they're expecting the child to jump from one to the next
Yeah.
at a certain pace. And that's something we do see here in Dubai, because the schools could be in English or French sometimes, or whatever the main language is. And then at home, we have mixed families. So someone speaks Italian, someone speaks German, and then there is the language that is shared with friends. And so that can create that little bit of a tension. I do believe that from different cultures, saying that your child, suffers from stuttering can be received completely differently based on what they expect from this, because they might have an image of, I like to say, the neighbor, not because it's really a neighbor, but that one person that they know who stuttered for life and can't really, so they automatically go to that one model that they have in their mind. Whether other people who have been exposed to this and see that it can be corrected environmentally, it just requires, weekly sessions sometimes for a few months, and then also for the family to adjust their pace and their expectation. And there are a lot of games that we can do with children. And Dr. Nu would have more to say about this. And that can be very easily rectified. Again, if mentioned on time, there is a window for this, for us to give the best chance of full recovery for the child. But that requires a tough conversation with parents to tell them, have you noticed that your child is gasping for air for a few seconds, or repeating the same words 3, 4 times, and so on and so forth.
I don't think I have much to add. I think that's exactly right. And I actually think that doing a little bit of self-reflection as an educator in this process matters a lot, because we do have our own biases about different cultures, and we do have our own biases about how people from different backgrounds might respond to certain
Mm.
concerns. And so I think after every conversation that you have as an educator, I encourage the educators that are listening to actually take some time after to be like, how did that go? Do I think that went the way that I wanted to go? Do I think I could have done anything differently? Did I feel like the family listened to what I actually had to say? And could I have done it in any different way or in a better way? Throughout this, I think throughout this, you sort of figure out a way to talk to families that incorporates a lot of cultural competence. And I think even more important, there's a lot of research on cultural competence, knowing what works for different cultures, knowing the biases with different cultures. But I think as a field, for example, psychology has moved from cultural competence to cultural humility. Why? Because we have families that are at the intersection of many cultures. Especially in the UAE, you have multinational families that intersect in multiple cultures. And so I think coming in with, okay, what biases do I have? I want to sort of take these biases and put them aside. I want to have this conversation. And then after I have this conversation, I want to reflect back on it and see how I did things and if I could do things differently with the next family that I see.
I love that. Okay, so let's say we're reflecting and we're reading and we're selecting the perfect words to say, and we have our observations, and we're going in this thinking about the parent and connecting with them. But then at the end, we get a let's just wait and see, and as an educator, that's really hard to hear when you're putting this child first. And you've already kind of waited to see, right? During that 6 week period where you're gathering your observations and your data, you've already waited to see. So you're pretty certain at this point that they say this. And, what are they really saying when they tell us that?
Um,
Please.
Sorry, I wanted to add my 2 cents. A lot of parents, let's say, let's wait and see. And sometimes we as educator would hear this as denial or disbelief. That would be the most appropriate term. It could be procrastination. They didn't want to hear the news and so on, but not necessarily. I want to acknowledge the fact that let's wait and see is not necessarily the worst thing you're hearing. It is very appropriate after receiving an overwhelming information that you need to take that time and at least knowing that you've launched, right, the inquiry. And anyhow, the next steps are not going to be with the educator per se. It could be a collaboration, but it's going to have to be referred anyhow to probably specialists. So saying to the expert, let's say, I say, I just really want the educators to hear this message. You have done everything you could have done in this moment. Now it's in the hands of the parents. Of course, you're here to support, but it's not you holding that burden of championing for the students. You've championed for them. Um, Now the parents need to hold that space. They need to make space for this. They need to make space for their concerns and worries and what's going to be next. Sometimes they have financial concerns about insurances, and things in Dubai can be quite costly, especially assessments. Um, they might have other fears again coming into the way of how it's impacting their life. And let's wait and see is not necessarily bad. It could mean I'm overwhelmed. It could mean I need more time to process, but that doesn't mean months. That could be just a day or two or next week. Or so it is absolutely okay to sit with them from my perspective to say, okay, you need some time. I can respect. I think you would gain much more by saying, okay, then well, I've waited already to tell so much to tell you this, and I really don't think you have time to wait. That's not going to go well. I would avoid that at all costs to bring that in.
Yeah.
Even though you're certain, this is urgent, I would still give that time.
Yeah.
Personally, that would be my advice. We'll let Dr. know. I'm sure she has
Uh,
more to add to
the
this.
only thing I'd add to that is, let's wait and see. What I read through those words is perhaps fear and apprehension, right?
Mhm.
I, I, I need some time. And so you've already planted that seed. And as educators and as providers, I actually think we have very similar roles in supporting families, not only supporting the child, supporting the family, that ecosystem. This is why we're a family centered clinic, is because the child thrives within the family. And so we want, as educators and as practitioners, to jump into fixing mode. We want to fix the situation. We want you to get that evaluation. We want you to get the appropriate support. We want the child to thrive. And I have to remind myself of this all the time. Like I can't fix things for people. I can provide them with my recommendations. I can provide them with my thoughts, But one, they are the expert on their child, and two, we can guide and support them. But as much as we want to fix things in this scenario, all we can do is guide and support.
Yeah. I love what you guys said. As a principal, I've come to pick up over time that it's usually just the parent's nervous system buying time as well. They've just received something, as you guys said, it's overwhelming, without warning, in a room that already has power imbalance. Let me mention that. So when a parent walks into our classrooms and our offices as principals and they sit down, there's already a power imbalance. We're portrayed as the experts, the specialists, we know, and they don't. And, of course they would want to wait, but what I learned as a principal is sometimes the hard way, is that when I push in that moment, it almost never works and I lose the relationship. So the families who eventually come back to the conversation after they wait and see are the ones who felt like I genuinely cared about them and their child, and I gave them that space to process. And our relationship is what brought them back. I wanted to jump from here to talk about, the misconception that parents also deal with in terms of them going for an assessment or going for that next step and then having their child labeled permanently, let's say, or them thinking that once they go down that path that we're advocating for, there's no coming back from it. And how do you guys address that?
What, maybe Dr. Jihane, you have something from like a professor perspective to add, but usually how I address it with parents is before the evaluation even starts, I say, this can be parents can have a lot of questions coming in, and I do these 20-minute consultations over the phone before to make sure that all their questions are answered. And some of the most common questions are, who will the report go to? And, what will happen to my child? And what does this mean if, they meet criteria for XYZ diagnosis? And so what I tell parents is the report goes to you. As the parents, the report goes to you. If you would like me to share it with the center, I would ask for a written authorization of release. This is how I gain the family's trust and the parents' trust. It's empowering. Yes, of course they want you to have the report, but it's empowering for them to know, like, wow, I am sort of, this power dynamic is sort of not so much the case, and I am the person that's in charge of taking the decisions here, and it's actually very empowering for parents.
I've not much to add on that particular point, but sometimes I like to compliment and again, the expectations. So parents would come up with their questions, and then I would say, well, do you know how long is that test supposed to be? Because I deal with adults. Dr. Nour treats both the families and young ones. And I would say, do you know how long it's supposed to last? Because time and again, I've seen patients and families and parents in the waiting room and going, is this supposed to take this long? Does it mean that something is wrong because it's been so long? So they might know they're coming from an assessment. They might not know how long it is. Sometimes there is also, an assistant, a psychologist assistant helping the main psychologist of the center. So they're running multiple assessments, and the psychologist is coming in while the standard tests are being administered by the assistant, and the psychologist would come into the different rooms. So by the time everything gets calculated, so do you know the processing time, do you know how long the assessment takes, can really reduce that anxiety of waiting by saying, well, it doesn't mean something is worse because it's taking 2 hours. This is supposed to be a 2 hour. Well, it's usually not that long for children, but give them a little bit more just so they don't start to construct things in their head or imagine that it will be instant. If you already have that data from previous families that you've ran over, it's really good to add that a little bit of an additional, and I don't think it's overwhelming in my opinion. In the contrary, then they know exactly what to expect on the day.
How much of your time would you say you spend coaching parents or talking to parents about the label as being permanent or not? Because the word diagnosis, I mean, that could be seen as almost like a stamp. I know when I either toured parents or discussed something like this, they always felt like it's something that's decided once and it can never be undone. And they used to view it as um, I, I don't know what it was, almost like a sentence being given to their child before their child even had a chance to discover who they were. I always used to tell parents to view it as a door, and because it's something that can get your child access to support or help that otherwise they wouldn't be able to access had they not had it. But then I thought it was always like an uphill battle to try and portray it that way when the reality on the floor says it often carries a negative connotation.
Dana, that's exactly right. Especially with ADHD and autism, I see that as happening a lot. People are like, is my child going to be on Adderall forever? If stimulants are something that they choose to pursue. And I always say, there is a lot of research out there on, what happens, the developmental trajectory, the general developmental trajectory of ADHD symptoms. And with support, with appropriate support, people do thrive. And sometimes with my teenagers, the teenagers that I work with, if there is a diagnosis, we actually look up people that are famous that have that diagnosis because the way that I describe diagnoses to families is we all have strengths. Dana, your strengths are different than mine, and my strengths are different than yours, Dr. Jihane, but we all have areas of growth as well. And what these assessments do is identify what your child does really well in. And that's really important because a lot of accommodations are strength based. Okay. And what your child just has a harder time with. And if we need a diagnosis to label what your child has a harder time with, it's not because we want to put this label or stick a label on your child. Trust me, as all of us are parents, there is, nothing more we fear than a specific label for a child. But that diagnosis is there exactly for what you said, to provide you services and support so that your areas of under construction is what I call it with teens. Like if there are certain areas that are under construction, we facilitate the construction and then they work equally as well, or if not better. Um, so I can even sort of put two college students, let's say, together, one that's received intervention services on homework, organization, time management, planning skills, and someone that hasn't. And I can almost assure you that there will be a difference in outcomes on, assignment completion, procrastination, time management. And so these interventions work, but sometimes we need to identify what it is so we figure out what it is that helps.
That's beautifully said. I want to underline what you said, Dana, about it opens doors. It does also open doors, and I try to show parents sometimes that the diagnosis is not just also for the child; it's also for them, because it becomes a manual of expectations and then growth charts. So, for example, if I know that these outbursts or these transitions are particularly hard within this, neurodevelopmentally condition, then they can recalibrate the expectation, the frustration, not to the age, but to what they're dealing with. And then that creates a much smoother environment. So when you have a label or a diagnose, you also know that you have access to all this research and resources. And yes, maybe unfortunately, there are parts of any culture, any society that will have stigmatization. I mean, that is not something we need to ignore. But you know what? There's also a lot of parents going through this, and then you can tap into that. And then some of the best friendships are done and surrounded around a time of need where, parents have met through this and this condition, and then they've just bonded. Whether the diagnosis is something that the child will carry for life, or it will be resolved. But, you've made a friend in that specific moment around, that support that you needed. So it is not all about how to, avoid the stigma and how to protect the child. They are literally new doors opening, and some are really beautiful and life changing and very enriching.
Okay, so let's say the parent has heard the concern, they're open to it. Um, they might have, a little bit of anxiety, but the referral process begins. Walk me through what that actually looks like, because I think a lot of educators, they support families to that point, and then we sort of feel like we're handing them off into the unknown because we don't really know what comes after that.
Yeah. Dana, what I will say to that in response to that is I think this is where partnerships are really important because it doesn't stop there. Actually, evaluations, all my evaluations, I've never done an evaluation unless, the parent has significant concerns and doesn't want to involve the teacher, but I've never done evaluations without the the teacher or, the educator being a part of them. Actually, you are the expert on child development. You've seen this child in class and know, compared to peers, how this child behaves. And so what I say is once you've done the referral, parents have accepted it. As an educator, what I actually would encourage you to do is ask parents for permission. I know this is a lot, and I don't want you to navigate it on your own. Ask for an authorization of release of information. Like, may I, or I encourage you, once you pick a provider, could you sign a release of information so I can communicate, some of the things that I'm seeing in the classroom? That collaboration starts off successful from the start because those accommodations and recommendations at the end when we share the report with families is going to come back to you as what might help you in the classroom. And if you've already had this teamwork from the start, it just makes it a lot easier. And the families that I've seen do that and the educators that I've seen say, I know you all are really busy and there's a lot of expectations and it almost sounds like these expectations keep adding up. But if you make like a 10 to 15-minute call with the provider, if the family provides you with permission to do so, that really changes a lot of things from the family's perspective, but also from you and how empowered you feel as an educator to help the child as
Um, yeah, for the referral on my end, I would complement this a little bit to ask. So if the parent says, so what resources can we have? And this is aside from the assessment that Dr. Noor covered really well. I'm thinking of the parents themselves. If they need support for them, I would invite them to consider a few things. So when they're looking for a psychologist or for someone to support them individually or as a couple, I would they would actually need to ask themselves, am I more comfortable speaking to a woman or a man? Am I more comfortable speaking to someone who's younger or a little bit older? Um, do I like to um, do I like to receive? I mean, it's going to be a general term here, but homework or task. Am I more task oriented as a person, or am I more? I just want to to speak and then really decorticate this and analyze this and maybe go back to what it's echoing in my past. All these sub questions that I've just asked you would completely obviously direct you to different types of psychologists, obviously not just by their gender and age, but also by their school of thoughts and their training that they've had. So having a bit of that think when the time is right. This might not be a first meeting conversation, but when they reach out to say, well, do you have any resources that you trust in school? Before saying, yes, here are the leaflets, invite them to have a bit of the think, well, you should think about like, how would you feel talking to a man about this situation versus someone a little bit younger or someone, and then that would also help them guide through all these different leaflets because I'm sure there are plenty of really good experts here. And also, I think geography is a big thing. How far away from the home if online is available and whatnot. So it's a good thing to have before we embark because every session can be quite costly and not all insurances, cover that. And that's an honest conversation to have. You can request sometimes 20-minute call just before so you get sorted to the right place. But again, not every clinic affords that. But yeah, these are empowering tips, I guess.
Yeah, those are amazing. Honestly, they brought me back to something that I heard a psychologist say to a parent, and I think might have been my second or third year teaching. where a child in my class was getting assessed, and the psychologist came to see the child, and then they went into a room to talk to the parents, and the parents were so anxious. And I remember her saying that the test that we've administered, it's not a test that a child can fail. Like I'm not looking for what's wrong in your child. I'm looking for what's needed. And I think in that moment, or just that phrasing changed so much for the parents, because they didn't see that their child had a deficit, or their child was failing at something. They saw that their child's needs were just a little bit different. I think that reframe goes to what you guys were saying all throughout this episode, which is again just selecting our words and making sure that we're trying to partner with parents as best as we can, and getting them to feel that we're in this together. We've covered so much ground today, and I wanted to end somewhere that I think is important, because sometimes in these conversations we get focused on the challenges and we forget to talk about what's really possible when we adapt all of this, all of these advice. So I wanted to end with one question. What does a successful journey actually look like for a child with additional needs in your perspective?
Do you want to take that first, Dr.?
No, I'll let you start.
Okay. Okay. So success. I think what a successful journey looks like is when the child feels safe, understood, and accepted. Okay. There's nothing wrong with me.
Yeah.
My differences are accepted
Yeah.
and understood. Okay. The parents feel safe and supported by, the psychologist working with them, or psychiatrist or provider, as well as the institution, as well as within their homes. Like if they perhaps need to seek speech therapy services or behavioral therapy, they feel supported within that. And 3, that the center feels also empowered, well-resourced, and equipped for that child. These are, I think, within this ecosystem, because I think of things a lot in ecosystems, the child, the family, and the center, they all feel, supported and united in the care of the child.
I have nothing to add. She absolutely covered everything.
Nailed it.
This is like a perfect.
I mean, I'm blown away too, because honestly, it is an ecosystem, and how often would we think of that? I want the educators who are listening to kind of reflect on every referral that they've ever made, and the ecosystem, and did every part of that ecosystem feel safe and trusted and supported? Even the center, as you said, are they resourced to support that child? Because they have to be. What's the point of getting up to that point and then not being able to show up for that child in the way that you're advocating for? So absolutely.
Dana, there's one last thing I will add as a piece of advice to all the educators that are listening to this, if it's okay with you.
Yeah, of course.
And this is a piece of advice that I've learned throughout grad school and my years of experience post. That is peer consultation. Ask if you don't know how to relay your worry to a family, or discuss certain situations, or if you're worried about culture, or if you're worried about a family's reaction, peer consultation. Consult with someone that, of course, within confidentiality limits, but you have your principal of your learning center, you have potentially additional teachers that have gone through that. Don't feel like it can be overwhelming for the educator to have to relay all this information, and it's easier said than done, I promise. But I think peer consultation is how we all grow, and I still do peer consultation to date with several of the tricky situations that I'm in, and I think this is how we learn from each other.
Yeah, I think that's beautiful. One of the psychologists that came for an assessment for a child in my center actually recommended that. She said, I wouldn't really be able to advocate the best that I can for this child without having a nutritionist on board, because for this child, whatever their condition was, it was also affecting their eating. And she said that for me to give the best possible answer or support or strategy, I'm going to need somebody who's an expert in this present with me. And I mean, sitting in on that conversation with so many different lenses, all advocating for what's best for the child, was one of the most beautiful experiences that I've been in. And I think both the child and the mom left that conversation feeling so supported. And how can you not when you have everybody looking at every possible lens possible for your child? I think that's such a beautiful and honest place to land. Thank you so much, Dr. Jihane and Dr. Nour, for the care and clarity you brought into this conversation today. The families in this region are really lucky to have people like you doing this work. For anyone listening who wants to reach Caya World to find out more about their assessments or their clinic, I'll have everything linked in the show notes. And if today's episode resonated with you, share it with an educator or a parent who might need to hear it. That's how we make this kind of knowledge move. Thank you so much, Dr. Nour and Dr. Jihane.
Thank you.
Thank you, Donna. It was our biggest pleasure.